My name is Mayor Sean Dowse, and this is part of a continuing series of talks I'm having with people around Red Wing about how we're working together to get through this terrible time. And as we've learned from previous interviews, that people are really working hard together in different aspects of all around Red Wing and lifting each other up so we can get through this. Today, we're going to talk about the Mayo Clinic Health System in Red Wing, one of our major partners in helping us get through the COVID-19 crisis. We're talking to Dr. Brian Whited, CEO, Mayo Clinic Health System, River Corridor. Before we get to talking about COVID-19 and all the issues you're facing on that and how you're how you've ramped up to engage to this crisis, how are you guys meeting the other healthcare needs of folks in Red Wing and the region who aren't involved in the COVID-19 issue?
Well, thank you, Mayor. Certainly that is a challenge for us now to make sure that we keep with our core principles of wanting to keep our patients safe, wanting to keep our staff safe, and try to meet the needs of everybody in the community, knowing that we have this crisis going on around us. So what we're trying our best to do is to really prepare people for getting their care maybe in a little bit of a different way than they're used to. So one of the things we're trying hard to do is understand which patients, of course, have an emergent need. We are open. We are open for emergencies. We have our emergency department staff 24/7. Our hospital is open, and we are prepared for those emergencies. So people should rest comfortably knowing that. For those patients that have a more semi-urgent need, something that's come up that really isn't an emergency, but boy, it sure can't wait, we are asking them to call their primary care provider or to call the medical center, and we'll work on triaging them to make sure that they get the care that they need in a timely fashion. And we certainly do have patients that still need to come to the campus because they need some sort of a diagnostic test, or maybe they trip and fell and they need an x-ray. And so we encourage them to still call first, and then we will get them into the facility as we need them. And then the more routine sorts of care, boy, I usually go in to get my chronic disease monitored every so often, maybe 2 times a year, maybe every 3 months. Those people, we're really trying to steer to a more virtual option. So we're really encouraging people. We're doing lots of virtual care through the phone and through video visits, actually. And we're really finding out a lot about how we can deliver that care in a new and exciting way, trying to meet our patients' needs. So I think the main thing for the community is we're open, we're there, we have the ability to manage things, but we're just doing it in a little different way and trying to keep people as safe as we can.
Okay, that's great. Really great to hear. Good work. Thank you so much for being there for us, for all of us in this new world we're in the middle of. So, what should members of the Red Wing community do when they or someone they love thinks they have COVID-19 or any symptoms related to that?
Yeah, so we've really been trying to educate the community about what do you do in this scenario. And there's lots of resources out there for people, but essentially the short and simple answer is just call. We want people to call us. We have had staffing our nurse line. We've added additional staff. We've added additional nurse lines specifically for COVID-like symptoms, so that we can have people get into the right triage, if you will, get their questions answered. And if they do need additional testing, then we can steer them where to get their testing done. So first and foremost, probably is call, keep yourself isolated until you know more. Try to not be out in the community until you get further instructions around some of these symptoms. As you probably are aware, we have put together a drive-by or drive-through testing center in the old St. John's Hospital. So that's typically where we are steering people to get tested, but we encourage and ask that people call so that we make sure we get the right people through that testing center. People that just drive up without an appointment, so to speak, that doesn't work very well. So we're encouraging people call, and if they need testing, we'll steer them in the right direction. If they don't need testing, we might be able to manage their symptoms either virtually, or on occasion, people need to come into the emergency room or to the campus.
The important takeaway there is to call first.
Call first, or if you have a patient online account with the Mayo Clinic, you can certainly send messages. There's also some tools on that to help people do self-symptom assessment, so they can work through their own questions, and that would could lead them to interact with a nurse online. So we've tried to set up various ways for people to get that information when they need it.
Can you tell us about the importance of the antibody test and the convalescent plasma treatment announced last week?
You know, that's very exciting. You know, Mayo Clinic, as its core tenets, has always been about innovation, research, education, as well as our practice. And one of the things that this really points out is Mayo Clinic is working hard in this new space of the coronavirus and the COVID-19 disease to develop new things that can help us treat those patients. And one of those is this test. So this is a test that has been developed to help us understand those patients who have been ill with coronavirus, whether they've developed the immunity or antibodies to their disease. So the test is really very new. We're not quite exactly how we will use this test in practice. That's what needs to be discovered. But early on, I think we're just trying to make sure we have a test that allows us to know if people have developed these antibodies, that we can be more safely assured that they aren't going to be vulnerable going forward. It leads us into the second part of this, which is some of the things on the national news and even more locally through Mayo. You've been hearing about this use of plasma and treating those seriously ill patients with COVID-19 with plasma from patients who have recovered from the disease. Well, that's what this test is really meant to do, is to determine which of those patients have the antibodies so that they could be potential donors of their plasma to start to develop this new treatment option for those most sick and ill with this disease. So it's really pretty exciting at times in that front. Of course, it's really challenging times in just the entire COVID-19 front, but this is one of the glimmers of hope for us going forward, that we've developed a new test that could lead to a new treatment.
Boy, we're lucky to have you guys in the community, let me tell you.
Well, we're glad to be here and glad to be partners with you.
Yeah, so great work, thank you. Is there anything else you want to tell Red Wing before we end?
Yeah, you know, again, I think we're asking our patients to do, you know, what the governor of the state's been asking people to do, which is, you know, stay at home, make sure you're socially distancing yourself when you get outside, and then, of course, you know, good hand hygiene, you know, make sure that you're really caring for yourself. These are challenging times, but we do think that this social distancing and stay at home is working. It appears to be flattening that curve, and we feel each day that goes by more comfortable that we aren't going to see that type of surge that maybe we were all worried about early on when this first developed. Each day stands on its own, so we'll have to continue to be diligent, like the governor said in the last few days. That's why he's not letting us go back to work in life as usual, because we have to keep diligence on this. But so far, we're pretty happy to see that we see some of that working, and it feels like it's flattening the curve. So I think, again, take care of yourselves, take care of your family. If you need us, we're there. We can help. We are starting to work our way into some of that more, if I'll call it, less emergent care, figuring out how we can care for patients in a safe way that keeps them safe, keeps our staff safe, and we will find it together with our patients how we might be able to do this differently than we've done in the past, using new tools, new technology.
Well, thank you so much, Dr. Whited, about your and Mayo Clinic's contribution to the health of our community in all sorts of ways,
Yeah.
and particularly helping us get through this crisis. Really appreciate it.
We enjoy the partnership we have with the community of Red Wing, other agencies in the community, the county of Goodhue. We're all in this together, and it really is exciting to see how coming together we are managing this in a way that we will get through this. There is no doubt we will.
Right. Yes, we will. It's going to be tough, though. I mean, it's going to be a slog.
Yep.
So
Yep.
Thank you so much for joining me, and thank you all. Thank you everybody for tuning in today. Talk to you soon, and stay well.